Insights from the world's best medical minds. You are watching therightdoctors.com.
Hello, good evening. I am Dr. Avinash Supe. I am the Executive Director of Hinduja Hospital, Khar, and you are watching me on therightdoctors.com, India's leading medical knowledge platform. As you are all aware, we are now 6.5 months into COVID, and in India, it has now for more than 4 months that we are dealing with COVID patients. Now, over a period of time, we have treated a lot of patients of COVID, and we have interacted with all the doctors, and we have seen the patients' responses, and we have got a lot of knowledge about what are the various medical therapies and the other therapies which are useful for COVID. And I'm going to share with you our experience and some of the myths which people have in their mind. I'm trying to clarify that. As you are aware, COVID is usually today diagnosed with an RT-PCR test, and this is usually takes about 24 hours. Now, once patient is diagnosed as COVID-19, the first thing is to do a risk stratification. That means based on patient's age, his comorbidities, the kind of symptoms he has, and the other parameters like is he breathless, does he have what kind of symptoms he has, does his chest shows any pneumonic patches, what is his oxygenation levels, saturation, and many other factors like interleukin 6, CRP. You would like to categorize your patients into asymptomatic, mildly symptomatic, moderately symptomatic, severe patients, and critical. And based on these patients, which category they are, either they are home quarantine or taken to a quarantine center like CC1 and CC2. But moderate patients who need oxygenation, who need better monitoring, are usually shifted to a COVID healthcare center or a designated hospital of COVID or in COVID ICU. Now, this is where the medicines and the investigational therapies are of great value today, and we must really discuss what are the various medical therapies which are available. When COVID came sometime in March, everybody was started using HCQ, that is hydroxychloroquine. That time there were not many drugs, and drugs like hydroxychloroquine, azithromycin were given, and sometimes even Tamiflu that was really given to the patients, which is commonly given in a swine flu. Now, over a period of time, we have not got any evidence for hydroxychloroquine for treatment of these patients. Though the people are using it for prevention, if the patient does not have a cardiac kind of an anomaly, or he does not have any issues with the cardiac, he has to take an ECG, then it can be given for prevention as per the ICMR kind of a directory. However, there is not a proved scientific evidence for this. The many other drugs were also used, which included the lopinavir, rotonavir, many other antiviral drugs were used, but none of them has been useful and proved to be scientifically useful. So in that case, what people started using is investigational therapies. That means many therapies which came newly over a period of month of May and June, where there is a limited available evidence in some of the literature. However, because there is no other drug and we have got now emergency use of authorization of these drugs. The most commonly discussed drug today is remdesivir. Now, remdesivir has been used now in many patients abroad, and it has shown almost in the New England Journal of Medical in the May showed an article which was used in 180 centers across, and it showed a benefit in the hospital stay. That means the hospital stay was reduced from 15 days to 11 days. There was a doubtful survival advantage, 7% versus 11%, which was not statistically significant. However, we are now into various kinds of new studies where there's a solidarity trial which is going on. There are few trials have not shown any benefit, but if you look at the experiences of people used in India and where all over the world they have used, they have said that if you use the remdesivir in a right time, early disease, then probably it can be of some value to patients where they recover. And therefore, we are looking for a solidarity trial which is now going on at many centers, and we would get some time to get that data. Now, when people are giving remdesivir, we have to really see that it should be given to patients from early to severe diseases. Those patients who are not on ventilator, it is shown to be more beneficial. As per the literature, it is A1 or A2 level evidence. That means it's a good evidence to say that it works in those patients. Patients who are on ventilator, there is a little lower level of evidence, but it can be also used in these patients. Then, of course, there was how many days you have to give. Now, usually advised dose was initially was 5 days or 10 days. Now, there was a trial in NEGM somewhere in again May, which showed that 5 days is more than enough. So today, what most of the people would give, they would give 200 milligram, that is 2 vials on the first day, and they would give 100 milligram over next 4 or 5 days. I think this dose of 6 to 7 ampules is more than enough, and it has shown a good kind of an help in many of these patients. And therefore, I think most of the hospitals or the government should really keep a stock of these drugs, and you should monitor and give to these patients to the specific areas where it is going to be useful. So don't give it to the early asymptomatic or mild patients. Keep it for moderate patients and severe patients where it is going to make some change. The second drug which is being talked about in this is tocilizumab. Now, tocilizumab is used to suppress the cytokine storm. As you are all aware that COVID-19 kills because of excessive or cytokine storm in a patient. And it is more commonly seen in elderly patients and comorbid patients. And therefore, you need to suppress that cytokine storm. Now, how do you really do it? The simple dexamethasone in a lower doses can be effective in this particular phase. Those who fail or do not respond to lower doses of dexamethasone, this is where tocilizumab works. And this has to be given as a single dose, may be repeated after 7 days, but ideally many places the single dose is more than enough. And there were retrospective studies which suggest benefit in Italy and USA, and these 3 trials were really done. Of course, there were some news reports which also said, but it has both these drugs, whether it's a remdesivir or tocilizumab or dexamethasone, they have their own share of side effects. It is shown that it may give high incidence of the pneumonias. It should not be really given to patients who have likely to have a TB activation. It should not be given to patients who have a renal disorders, and therefore we should not really use it and use it properly under the expert kind of a guidance, because it can cause a lot of damage to these patients also. So somebody needs to really cover it well, and if there has to be, if there's a risk of secondary infection, then you may have to use very high antibiotics. And there are now many trials which are really going on, like randomized control trial in progress. There are so many, about 5 or 6 trials which are going on in the world, which probably will help you to understand these drugs. Another drug which has been tried in now India is what is called as a flavipiravir. Now, flavipiravir has no proven data in India, but there are 2 studies. One showed some effectivity that was published into engineering journal, while other does not really show any effect. However, it was a drug which was repurposed of an influenza drug, which was used for influenza, is now being used, and Japanese RCT is still going on. There are 3 Indian trials which are going on, 2 by Glenmark and 1 by Cipla. The data is not released yet. However, it is a drug which cost about 12,000 rupees for 1 dose, and we can use it for mild patients who are coming to us, and we can give that. So if you really see, remdesivir today cost about the MRP is about 5,400, but it can be sold at any price around that, and you require about 7 to 8 ampules, so it costs around 40-50,000 rupees for 1 patient. Similarly, tocilizumab also costs around 40,000. So these are all costly therapies, and therefore they should be given to patients who really need it. There should be a stratification or guidance for these patients under the expert guidance, and you should also watch out for any side effects which are likely to be there. There are other drugs which are very commonly used, as I said, the dexamethasone. Dexamethasone or its substitute methylprednisolone are used in a low dose. They should be given many times. A patient comes to you today. What has happened, whenever there are patients, they start seeking, they don't get a bed, and they're waiting in casualty on an oxygen. I think that is a stage where you should give them dexamethasone one dose so that they don't progress further. Low dose of dexamethasone more than enough for these patients. If you give too high a dose, it would cause a lot of infections. Similarly, I think these have really saved a lot of patients in this particular patient. Another very commonly drug we should really use for all patients is anticoagulation therapy. These patients, I'm sure many people do D-dimer, people do the ferritin and many other levels of these patients. Now, coagulation is the major cause of death in these patients. So therefore, you should use low molecular weight heparin, and even if it is not available, then even a heparin fraction, UF, what we call as unfractionated heparin, also can be really given, and that works very well, and it can save lakhs of rupees for you. But if it is available in any setup, then heparin is something which has been life-saving in many patients. Low dose Dexa, as I told, has proved a proven benefit in a recovery trial. Those who go on oxygen, cytokine storm phase, early phase, you should really give them. It's a cheap and safe drug, and it is easily available in all hospitals. Other drugs like loponavir, rotonavir, or itolizumab have not much of evidence. There are some trials which are going. Solidarity trial has stopped recruitment of other these drugs. There is no evidence for other MABs like itolizumab. HCQ, as I said, has no evidence in the hospitalized patient. It has query role in mild disease or preventive, and there are some trials which are really going on. Now, there are many other drugs which are also being used, like ivermectin, which is an anti-parasite drug which has been used along with the doxycycline for prevention as well as some of the treatment. There are people using other drugs like colchicine, where to reduce the immunity. But however, the data for these patients is not adequate, and therefore, if you should really train these patients, that is the way you would like to train. When somebody is giving remdesivir, you must also do liver functions, renal functions. You should not give it to pregnant and children. Another common therapy which has been tried today is a convalescent plasma. And again, this is an off-label use. Many of these drugs have got special permission from the ministry and FDA for in this COVID kind of a crisis. Convalescent plasma, after 28 days of patient suffering, when he has an adequate IgG levels, when you do an ABO compatibility and neutralizing titers of donor plasma are not available, you can do plasma IgG titer, which should be above 1:640, and then it can be really used. Recipient should be closely monitored, and this should be avoided in patients with IgA deficiency and immunoglobulin allergies. So these are some of the new drugs which have been used extensively in India, and they have shown very good results now in, compared to what we were seeing in the month of March. In the initially, what we found that 3 or 4 things would really reduce the mortality. One of the thing was having a community kind of an education and make patients come early. What happens when patient usually gets symptoms? He goes to a pharmacist or a local doctor who gives him paracetamol, treat him. In 2 days they don't get well, then again they wait and go get a testing, which was very difficult today. But now it has become very easy. Now in Mumbai, a city of Mumbai, anybody can get the testing done without prescription. But the patient used to take about 5 or 6 days before from onset of symptoms to getting into hospital. Now this is too long. So patient should be brought to the hospital as early as possible within 48 hours. And then if you really see, these are the patients who can really save. The second point is look for all the comorbidities. Look for something like diabetes, hypertension, cardiovascular diseases, renal diseases, cancers, obesity, hypothyroid, and some of these were seen in young patients who died. So I feel these are the comorbidities we should really watch, and we should really check whether these are the uh, patients where we need to really look and monitor them. And how do you monitor them? You would like to do 6 hourly their blood sugars. You would like to do their 6 hourly oxygen saturation checkup. One of the thing which was thought was happy hypoxics. Now, what is happy hypoxics? Happy hypoxics are those patients whose saturation is around 95 to 99 when they are sitting. But if they go and walk some distance or go to toilet, suddenly it becomes 90 or 90. And if you see FaO2, that can be really low at 70 or 80. And many of these patients come with a very low oxygenation, with bilateral pneumonias. And these are patients who are very difficult to save. Secondly, when the patients are admitted, they need to have a proper oxygenation, whether you can give them with nasal cannulas or high flow nasal oxygens, or whether you can give them with NIV, BiPAP, or you may have to intubate. And if necessary, if they are not meeting their oxygenation, you should intubate and try to save them as much as possible. This is the message from the ICU specialist. Though initially it was thought that you should avoid intubation, but now the newer advice from the ICU expert is that you should try to do if they are not maintaining, so that many people are coming out in spite of they deteriorate early, and when they are put on to this kind of oxygenation, they improve better. Proning, awake proning, whether even patients on ventilation can be really proned, and you normally try to see that they get a good physiotherapy, they get a good supportive therapy, nutritional. I think these are the ways by which the patient can come out. So supportive therapy, good oxygenation, the antivirals, some of these newer investigational therapies, and if necessary ventilation and an ICU management, we should be able to reduce the mortality to minimum. Now, what I'm really also going to do, there are some myths which people have, which I'm trying to solve these myths which people have. Now, commonly you find that people now are scared, and there are, in whenever you are going into the crowd, you should first see that you follow a social distancing, which now everybody realizing and everybody is trying to follow it. Secondly, you should wear good masks. People in a healthcare should definitely wear N95 mask and should take care of those masks, and others should at least wear a 3-ply mask, or nowadays there are a lot of new kinds of masks with 6-layer and 5-layer are coming, so they can be take certified mask. If available, you can also take the W99 with activated carbon kind of masks, which are can be good, which will prevent, and the mask should be worn properly from nose, and you should try to avoid touching those masks again and again. The third thing is you should be screening people for any shops or offices, either thermal scanners, or you can really check for their fever, self declarations. And the last point is sanitization. You should try to use sanitizers. You should sanitize the place where you are really sitting. These 4 strategies, like say social distancing, proper kind of use of masks, screening, and sanitization, are extremely essential. And in next few months, we have to live with corona, and we have to live with these 4 kind of specific things which we need to do. Now, some of the facts, people say that we should not really wear the mask while exercising. Now, people should not wear a mask while exercising. Yes, that you should do. People continue to wear exercise, and they should not wear masks at that time, because masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which makes it difficult to breathe and promote the growth of microorganisms. The important preventive measures during exercise is to maintain the physical distance at least 1 meter from others. So now if the gyms are opening up, now we are unlocking ourselves and people are going to gym, people are started working into gyms. That time when you are exercising, we should not wear a mask. The second myth is that our regarding, can our shoes really transfer the COVID kind of viruses? Now, likelihood of shoes transferring our COVID-19 viruses is very low. It's not very high. You know, COVID is a heavy virus, and it can really fall down, and therefore we should really see that we normally should, if possible, you should keep your shoe wears outside your house, not bring them in, especially if people are playing around it, and therefore you prevent contact with the dirt or any waste. and on the soles of the tissue. Another myth is that people use antibacterials, that is antibiotics, for this viral disease. All should importantly remember that COVID is an viral disease. It is caused by the family of viruses called coronaviridia, and antibiotics do not work against it. Antibiotics are given only if the patient has secondary infection, septic shocks, other infections. It is not for the viruses. So one should be very clear that antibiotics just taking on the table or across the table is not really going to really make any difference to this. Then another thing is that the prolonged use of medical masks, if their use can cause CO2 intoxication. That is one of the worry people have, and it can cause oxygen deficiency. If the masks are used properly, and if they are properly, you use them, use them properly, then wearing a medical mask can be uncomfortable for people who are not used to wear it. So choose a proper size of the mask, choose a proper fitting of your mask, and if you are able to fit your mask well, it will not cause CO2 intoxication or any oxygen deficiency. While wearing a mask, you should see it fit properly. There's always a clip at the nose. You should see that you are putting it properly. So people who are wearing spectacles should always check it, because if you don't do that, the spectacle will get fogged, and especially if you're driving, it can be very risky. So you should really fit the mask properly, and then only you should start driving these kind of masks. Now, another common thing is about that drinking alcohol will protect you from the COVID-19. There is no evidence that drinking alcohol will protect you against COVID-19. In fact, it can be dangerous. The harmful use of alcohol increases your risk of health problems. Sanitization, people are using sanitizers with 70% alcohol, but that doesn't mean that when you drink alcohol, it is going to prevent you from COVID-19. So that's a myth. We should all remain away from those. Then another myth, people say that thermal scanners can detect COVID-19. No, thermal scanners will never detect COVID-19 positive. It can only suggest that the patient has fever and can be a suspect, so he should not really enter into common places like malls, shops, areas like offices. He should quarantine himself. If necessary, he should check himself. And this is a kind of a screening procedure. Thermal scanning is not going to be the diagnosis of COVID. COVID-19 can be diagnosed only by a test, which can be an RT-PCR, which can be an antigen test, or which can be what you normally do as rapid antigen test. And if somebody wants to do again antibody test, it will not diagnose COVID-19. It will only tell you that your antibodies are. That means you may have suffered it indirectly without really knowing, if you have very high IgG levels, or in the community there are enough people who have gotten herd immunity. So that is where the antibody test is useful. Antibody test should not be used for individual diagnosis. For individual diagnosis, you should use RT-PCR test or a rapid antibody test. Now, as you say, I have told you already, there are no effective drugs for COVID currently. Whatever drugs are being used are investigational therapies. There are some of the drugs, in the experience of the doctors, have found to be useful. Therefore, we are using it, like remdesivir and tocilizumab. But you must remember, these are drugs which should be taken under the guidance of the experts, and they should be given by the experts rather than anybody in the shop. There are many first responders, like pharmacists, your first family doctor. They should not use these drugs. If necessary, they should refer that to the experts where they should really take. Another myth people have been really talking about is adding pepper to your soup and other meals, or using a garlic, which can really prevent COVID or cure COVID. There is no evidence like that to say that using pepper or garlic in your soup or in your meal will prevent you from getting a COVID. COVID is a viral disease. You can build your immunity by different Ayurvedic or Ayush or different techniques. It may reduce your chances, but there is no evidence to say that eating this is likely to cause something or prevent your COVID. Then another thing is that people say that COVID-19 can be transmitted through house flies. There is no evidence that COVID-19, because the monsoon has come, the house flies have now increased in many places, but there is no evidence to say that COVID-19 has been transmitted through house flies. So you should do sanitization to prevent house flies, but there is no evidence to say that it really prevents it. Then another common problem and pictures we had seen was spraying people with bleaching or another kind of disinfectants. We have seen pictures where many people coming from outside were sprayed. You can sanitize your surfaces with various kinds of sanitizers or Bactorubs or various kinds of bleach powders. However, you should really see that these are not something which will be of great help. In fact, they can harm the people, especially the pictures which were shown that people were sprayed on the roads with various these kind of solutions. They're going in their eyes. So that can be one of the most dangerous thing which can really happen, and we should avoid it. It does not prevent COVID. Again, drinking methanol, ethanol and bleach does not prevent or cure COVID, and it should be avoided over a period of time. Recently there was another rumor that 5G mobile networks are spreading COVID. It does not happen that way. You must really say that the 5G mobile networks do not spread COVID-19, because this is again a myth, and it will probably, everybody has to understand that telephone or when you're talking on a mobile, it will not really transmit the COVID to somebody, another person. When you are speaking loudly, it can really throw some of the droplets from the patients who are COVID positive, and it can cause infection to the others. And therefore, one must really be careful when you are talking in a public place, where you should definitely use a mask, not talk very loudly, and if possible, that is what you should really try to do. Then exposing yourself to the sun temperatures higher than 25 degrees does not protect you from COVID-19. There were rumors that temperatures, low or very high temperatures, can really cause a decrease in the COVID, but it has not found that way. The COVID has continued through summer in India, and it has continued through winter in the Western world. So the temperatures and exposing yourself to the temperatures is not of any help to you. Similarly, when you will find that there are many other, like say hot and humid climates will reduce COVID, we have not been able to really prove any evidence about this. Then another myth is that taking a hot bath will prevent a COVID-19. Taking a hot bath with a soap is useful, especially if you have come from outside or from a hospital, but it doesn't give you guarantee that you will not get COVID-19 because of this. And similarly, it doesn't travel through these mosquito bites, and usually it doesn't also, ultraviolet lights are also not very useful for thing. The last thing I would like to say that the vaccines trials are going on across the world, and vaccine trials will be ready by end of this year or maybe early next year. Though India has been trying to expedite this process, one must also see that when this is being tested, the safety of the people who are undergoing this trial and long-term side effects must be considered in this situation. And therefore, we must be sure that the vaccines are not only useful, but they are also safe. So I think by end of this year or next year, we'll get vaccines, and then only we'll be able to really fight this COVID-19 during this period of time. To summarize what I would like to say, that COVID-19 has now been stabilized in some of the cities. In some areas, it was very high, but now it is really coming down, especially in cities of Mumbai. But it is spreading into other areas into the country. So all of us should be very careful. Though we are now unlocking ourselves and we are now trying to improve the business and travel, we must take care that the screening, using mask, sanitization, and these four things, what I say, social distancing, must be followed strictly till the time this COVID crisis is over. There are newer and newer experiences are coming in, newer and newer investigational therapies are coming, and I'm sure those new trials will give us a data, and we hope that ultimately the vaccines will come and the herd immunity will come, which will probably help us to tide over this crisis, and then we'll go back to the normal. So I wish all of you stay safe, stay healthy, and fight COVID with all what armamentarium we have. And we should try to report early, avoid going into places where it is not necessary, and definitely we should take all care to fight this COVID crisis. Thank you so much, therights.com, for this live program, and I really wish you all a very stay healthy future. Thank you so much.
Insights from the world's best medical minds. You are watching therightdoctors.com.